Salmonella is a bacterial pathogen. Once it gets inside of us, causes an infection. That infection generally is a pretty severe infection, leading to vomiting, diarrhea. And oftentimes when people have salmonella, it could last for 3-4 days or even longer. Martin Bucknavage, Senior Food Safety Extension Specialist with the Department of Food Science. The latest outbreak were eggs from a distributor out in California. Those eggs were primarily shipped to a number of different states, like 7 different states, primarily on the western side of the country. And those eggs had salmonella in it. The salmonella originates in this case from the chickens. It's transferred to the eggs, and then from there, those eggs are then shipped into commerce. A lot of the issue, of course, arises when people cook eggs in a way that really doesn't provide sufficient amount of heat to kill the salmonella. So eggs that are cooked over easy, or if they're using eggs in some kind of recipe, like it's in a hollandaise sauce where they're using raw eggs. In those particular instances, if salmonella is there, it's going to be passed to the consumer. It really becomes especially problematic in people in high-risk categories where their bodies aren't able to fight off the salmonella, and it could lead to things, could lead to further worsening. The strain of salmonella actually, in this particular case, was shown to have some antibiotic resistance. And that can be problematic from the standpoint that some of the common antibiotics that we use to fight such infections are not available to the medical practitioners. It always comes down to the fact, especially for people in high-risk categories, is to avoid eggs where they're either undercooked or not cooked at all. Generally, we don't have an issue or have not seen an issue. So, I eat my eggs over easy with little concern. And again, generally those are being controlled. But if people feel that they're concerned about the risk, certainly cooking your eggs more fully is the way to get rid of it.